Good afternoon, everyone. We want to welcome you, and we are so excited that you're participating in our very first virtual mental health. I'd like to thank our partners for working together with us to better serve the citizens of DeKalb County. We're also extremely thankful for CEO Michael Thurmond for having the vision in 2017 to create the Mental Health Roundtable, which has been a positive step in improving our services as it relates to mental health. His vision and these efforts have led us to this virtual mental health fair. So without further ado, I'd like to introduce to you DeKalb County's very own CEO, Michael Thurmond.
Thank you, Chief Ramos, and of course, thank you for your leadership, and thank you for picking up the baton to continue to improve and progress our DeKalb County Mental Health Roundtable. Your leadership, your dedication, and your vision is truly appreciated by myself and, of course, the 750,000 residents of DeKalb County. And we also appreciate those brave men and women in uniform who every day put their lives on the line to keep DeKalb County citizens safe and keep our families secure. Delighted to be here at this very special event. As the chief mentioned, we started in 2017, but it was really the inspiration grew out of a tragic circumstance in terms of our involvement with a young man who was undergoing a mental health crisis. Mr. Harris, his mother, Ms. Phillips, came to talk to me, and we promised her that we would work together to help to improve these interactions, to help to improve training and cooperation across the various platforms with men and women who are working to reach out to help to serve men, women, boys, and girls who are undergoing mental health crises. So I'm delighted that we're continuing to move forward. I'm inspired and very thankful to be a member of this team. But now I would like to introduce as our keynote speaker a young lady who is really par excellence. She's a legend in broadcast journalism in Atlanta and Georgia and all across this nation. She is someone who I consider a friend, but more importantly, she represents to me the very best and the brightest, a role model in terms of a person who is truly dedicated to serving our community. But let me tell you a little bit about her. I know what I know personally, but she deserves a more detailed introduction. Let me tell you, Monica Pearson has led a distinguished career in journalism at WSB TV as the anchor of the Channel 2 Action News at 5, 6, and 11. She is the first African-American woman and the first woman ever to hold the position of news anchor in the Atlanta market. Let's digest that. The first woman, first African-American woman to hold that position on any station in the Atlanta metro market. She's received 28 Emmy Awards, as well as other awards for reporting on her close-ups. She is a humanitarian who assists in charitable nonprofit activities, and she is a person who loves DeKalb County. She works with us with our foundation. She's involved, and she's married to a young man who has law enforcement in his heart. Reverend Pearson, her husband, is also a friend and a former DeKalb County sworn officer. So we're so delighted to have this family with us today. She received a BS degree in English from the University of Louisville. She's a recipient of the Women's Sports Journalism Award, Broadcaster of the Year, Woman of Achievement. A documentary, Hot Flash, The Truth About Menopause, won first place from the Atlanta chapter of the Society of Professional Journalists. So I want to just say to her, I want to thank her for being a supporter of DeKalb County, more importantly, for her and her family, her husband, being supporters of the DeKalb Police Department. So I introduce to you all an amazing, legendary figure in the history of our state, Miss Monica Pearson.
Thank you very much, Chairman Thurmond, my buddy. And you know, I'm very fond of your daughter, who's also in the business. And also thank you, Chief Ramos. It's my pleasure to be here today. And one reason is because this is Suicide Awareness Prevention Month. So we could not be doing this at a more timely time. But also since March, many of us have been living under stress, not only because of COVID-19, but we are pack creatures by nature. And to having to socially distance, some people not being able to work, some people not being able to literally feed their families or keep a roof over their heads. Stress has been at the top of everyone's mind and how to deal with it. And you know, nationally, people experience a mental health crisis are more likely to encounter law enforcement than a medical provider. As a result, 2 million people with mental illness are booked into jails each year. Nearly 15% of men and 30% of women booked into jails have a serious mental health condition. Now, that's frightening. That's very, very frightening. So what does this mean for us? Well, it means that we have to look at some other figures that we may not want to be comfortable with. It means that we have to look at the burden on the justice system, and it's created by these numbers. 30% of women booked into jails have a serious mental health, nearly 15% of men. So according to the American Psychiatric Association, correctional facilities have inadvertently become the largest providers of mental health related services. And today, the nation's largest mental health facilities, unfortunately, are the jails, not hospitals. At least 83% of jail inmates with a mental illness did not have access to needed treatment. On any given day, 1 in 5 incarcerated persons suffer from severe mental illness, SMI. Historically, people with serious mental illnesses were 10 times more likely to be in a jail cell rather than in a hospital and in a hospital bed. Collaborative efforts are being made to change that narrative. Now, today you will discover there are resources available to assist individuals and their families that are dealing with behavioral crises. Law enforcement, along with several mental health service providers, have partnered to improve the responses to people with mental illness. The goal is to improve access to effective treatment and to equip first responders with resources to better serve the community. It's important for us to remember that together we can raise community awareness and we can help provide the resources needed to help those dealing with behavioral crisis. Why? Because DeKalb County cares. DeKalb County cares. Now, we have so many people here today to provide you with information you need just in case. Our first presenter today, and each presenter will talk about 8 minutes. Our first presenter is Sheriff Melody Maddox, the High Sheriff of DeKalb County.
Thank you so much. I appreciate that, Ms. Pearson. Can everybody hear me?
Yes.
Okay, thank you so much. Okay, as you said, the DeKalb County Sheriff's Office is one of the largest mental health service providers in the county. And we provide around-the-clock mental health needs for the county, for the jail inmates. And just want to make sure that I go over a few things and so people will understand the effects that it have. Also, not just on the inmates, but as well as when they are incarcerated. A few things, as you can see here, the intake medical assessment, health assessment, and what happens is when those inmates come in, there are a few questions that are asked once the inmates, prior to coming in, to see what assistance they may need. We look at assessment-based housing. We have designated housing for mental health individuals, on-site medical health clinics staffed by mental health professionals, which is around the clock, psychopharmacology during incarceration and at release, meaning that they get medication once they come in. If they should need medication, we put them on some type of program. Also, when they are exit back into the community, we make sure that they have access to that medication as well. We give them a 30-day prescription, which we hope that they will go or get someone to assist them to go and have that prescription filled. We have group and individual mental health counseling. And that is through the Centurion, which is our mental health provider for the jail. And understand that Centurion has a state contract with the jail and has been providing mental health services for over 20 years. And DeKalb County inmates do not pay for mental health care or medication while in the jail. And understand one thing too, that about 22% of the jail's population requires and receives mental health services. They do not pay for any of that, but it does cost the sheriff's office about $3 million each year, and that is including the medication. The information for the hotline, the mental health hotline, is at the bottom, and we want to make sure that we let all the citizens know that if you should have any concerns about an inmate with mental health, please provide us with that information so that we can pass on to the physician that is on duty. But also now understand that we're not able to give any information in regards to unless that inmate provides authorization and approved. The phone number is at the bottom, which is 404-298-8525, 404-298-8525. And this information is very secure, it's confidential, and it does go to our mental health provider and all that are on the staff.
Our next presenter is DeKalb County Probate Court Judge Caroline Freeman. She will be speaking on behalf of Judge Bedelia Hargrove.
Good afternoon. My name is Caroline Freeman. I'm the Chief Clerk and the Hearing Officer at the DeKalb County Probate Court. Unfortunately, Judge Hargrove is not able to join us today. Her mother broke her hip over the weekend and is in the hospital, so please keep the Hargrove family in your prayers. But I will do my best to fill in and tell you a little bit about the role of probate court and mental health. I'm going to talk about 3 different types of proceedings today, and all 3 involve quick action on the part of the court. And we know how important these proceedings are to the community, and during the pandemic we have not shut down, but we have adjusted the way we do business. And I'll tell you a little bit more about that as I describe the proceedings. Let's begin with orders to apprehend. Now these are they start with folks providing what are called lay affidavits. And we can only enter an order to apprehend by the probate judge if 2 individuals complete affidavits based on observations they have made within the preceding 48 hours. And these observations have given them reason to believe that a person is mentally ill and requires involuntary treatment. Now, if the order to apprehend is signed by the judge based on the information provided in the lay affidavits, we take that order to the Sheriff's Department. And the Sheriff's Department must make diligent efforts to take the person into custody and deliver that person to the facility named in the order. Now, unless the family has made arrangements with a private facility, a court clerk will call the Georgia Crisis and Access Line to determine which facility the person will be transported to. Now, often it's the DeKalb Crisis Center. Now, an order to apprehend expires 7 days after it is executed. During the pandemic, we are asking residents to contact the court by phone or email to let us know you need to come in to do lay affidavits. Now, we have the contact information on this slide, and the clerk will explain the process when you call or email and set a good time for you to come in. Now, the next proceeding I'm going to discuss are involuntary commitment. Now, these are petitions that are filed by hospitals, and they include the recommendation of the chief medical officer of the facility, supported by the opinion of 2 physicians or a physician and a psychologist who have examined the patient within the preceding 5 days. Now, we see a large number of these petitions here in the court because we have several hospitals in the county. We work closely with Georgia Regional, Peachford, Emory-Wesley Woods, and the Atlanta VA. Prior to the pandemic, these petitions were filed in person or mailed to the court. But in March, we were able to start e-filing. So now that we actually require the hospitals to e-file, and it seems to be working well for everyone. Now, when these petitions are filed, we must act. We have to hold a hearing within 7 to 12 days from the time of filing. We appoint an attorney for the patient. And the standard we're looking for at the hearing is clear and convincing evidence that the patient is mentally ill and presents a substantial risk of imminent harm to self or others, or is unable to care for their own physical health and safety, is to create an imminently life-endangering crisis. Now, the court may order hospitalization for any period not to exceed 6 months. Now, prior to the pandemic, the court was holding all of these hearings at the hospitals. But of course, no hospital wants us showing up in person to do a hearing these days. So we're conducting all of these hearings on Zoom. And the hospitals have done a great job working with us to ensure the patients have the necessary technology to not only participate in the hearing if they choose to do so, but also to communicate with their counsel. Now, finally, I want to touch on emergency guardianships and emergency conservatorships. Often these proceedings involve a proposed ward with mental illness. Once again, when these petitions are filed, we must act quickly. We have to hold a hearing within 3 to 5 days from the date the petition is filed. The petition requires 2 petitioners or 1 petitioner and an affidavit from a licensed clinical social worker, physician, or psychologist who has examined the proposed ward within the past 15 days. Now, once the petition is filed, the court appoints an attorney for the proposed ward, and the proposed ward is evaluated by a court-appointed physician, psychologist, or licensed clinical social worker within 72 hours from the date of filing. That evaluator then files a report with the court prior to the hearing. The standard for emergency guardianship is clear and convincing evidence that the proposed ward lacks sufficient capacity to make or communicate significant responsible decisions concerning his or her health or safety, and there's an immediate and substantial risk of death or serious physical injury, illness, or disease. The standard for emergency conservatorship is clear and convincing evidence that the proposed ward lacks sufficient capacity to make or communicate significant responsible decisions concerning the management of his or her property, and there's an immediate and substantial risk of irreparable waste or dissipation of the estate unless an emergency conservator is appointed. Now, under law, emergency guardianships and emergency conservatorships only last up to 60 days. And emergency conservators have to post a bond with the court to protect the ward's income and personal property. In March, we added the ability for attorneys and self-represented parties to e-file these petitions, and we highly recommend this method. But if you need to file one and would prefer to do so in person, please contact us. We can arrange a time for you to come in and handle the filing in person. I think that contact information is on the next slide. Now, that's a brief overview of probate court and mental health. Please feel free to contact us if you have questions or you need to make an appointment. We are happy to help, and we are always here to serve the community. Thank you.
Thank you very much to the clerk, Caroline Freeman, and also to Sheriff Melody Maddox. We are getting a few questions, and the one that just came up, I think, is definitely for the sheriff. And that is, the first question was, are people referred to community help when they leave the jail? Is Sheriff Maddox still with us?
I'm here. I'm just a little tech challenged here.
That's okay. We all are. The question pretty much was, when a person is released from jail, are they then referred to a community health, a mental health group?
Yes, they are. We work with Grady Hospital as well as other participants that are actually on this call, on this meeting, to make sure that those individuals get the necessary help or resources after care post, exiting out. So yes, we do work with others to make sure that they get the proper care and to make sure that they stay on their treatment. We want to make sure that they stay on their meds and whatever the meds they have or counseling, that they stick with it. So our mental health providers do reach out to those individuals. Yes, they do.
Thank you so much, since that was a question that came up immediately. Our next presenter is the DeKalb County Misdemeanor Mental Health Court Judge, Retielia Stroud, Judge Stroud.
Oh, good evening. You said that so well, Monica. Thank you. All right, I am here on behalf of DeKalb County Magistrate Court and our Chief Judge, Beryl Anderson, as the presiding judge of the DeKalb County Misdemeanor Mental Health Court. All right, this is just a copy, a show of the judges that work with the court. And we also have a slide that just shows our full-time team that works with the court, but we also have part-time help from a prosecutor and a public defender. What's important about our court is that we are codified. That means that we are a creature of the law of the state of Georgia now as an accountability court, which means that we get funding from the state of Georgia to run our court. Our court is the longest running misdemeanor health court of its type in the state of Georgia, having been operable since 2001. We are now amongst another about 43 or 44 other adult mental health courts in the state of Georgia. Our focus, the main focus of this court is on treatment instead of incarceration, and that is very important about the misdemeanor mental health court. However, persons must have committed an offense in DeKalb County, and the types of charges are basically non-violent misdemeanor offenses, and we'll show you a listing of those in just a moment. The commitment to the court is for a full 12 months for any participant that is enrolled in our court. And once they complete our court, their offenses are dismissed by the solicitor's office, and their record is restricted. So no potential employer or university or college or anyone has access to that information. But while they're there with us the year, they have to engage in mental health treatment. There has to be a commitment to do that. They have to take all prescribed medication. There are random drug screens when we're live. And there are gender-specific groups to help them with more coping information and knowledge and awareness, a men's group and a women's group. There is a Thinking for Change cognitive group that helps with skill sets, that helps them learn various coping skills so that when they return to the community and to their families, that they just have more to work with. So what they are required to do as a part of our court is much more than they do than they're required to do when they just, get credit for time served. We require a lot more. So that's a misnomer in the community that it's a get out of jail card. When they come to us, they're committed to do the work to hopefully change their lives. And it is a 12-month commitment, as I indicated. Now, some of the primary diagnoses that are in our court, because there has to be a diagnosis, and the majority of our participant base are either diagnosed with schizophrenia or schizoaffective disorder. About 52% of our participant base is. And then the next is going to be bipolar, and that's about 27%. And then major depression is one of our diagnoses. We see about 13% of our participant base with that particular diagnosis. And PTSD is very much a part of our participant base that we see as well. So that's just some of the diagnoses that we see in the court. Here are listed some of the offenses that we will see, just kind of spelled out there for you. I'll give you a second to take a look at that. But those are some of the offenses that participants, when they come into the misdemeanor mental health court, that they're facing, that are dismissed and their records are restricted from those charges. These are some of the requirements or for eligibility for the court that is reviewed. Adults aged 18 or older, there again has to unfortunately be an arrest in DeKalb County. There has to be a documented diagnosis, no extremely violent criminal history. There is some batteries, there are some assault, but no extreme violent history. There has to be a willingness to engage in treatment and to follow the dictates of the doctors. There has to be the treatment availability for them, and there has to be a cognitive capacity because, as I indicated, there are some requirements for cognitive group therapy that we do have. There has to be housing, and oftentimes we do help with the housing issue before they're actually accepted into the court so that we can know where they are in the event that we have to engage in surveillance which we do at times. And they have to voluntarily agree to come into the court. We cannot force them. They have to agree. Hence, we do have the help of the public defender's office, and some have private counsel. But the solicitor's office is the office that we work with to get the cases into our court. So that office is very much a part of our team as well. What we have next is just a 4 minute video that just gives you the court, just shows it to you live. So let's go ahead and do that. And we're staying within our 8 minutes, Madam Moderator.
The jail's not going to give them treatment. I mean, we've seen people get arrested and sit in jail and not receive medication. If they're not raising a fuss or causing some kind of problem in the jail, they're just sitting there being peaceful and quiet. They'll do their time and they'll release them, still unstable.
There has got to be a better way.
A NAMI advocate named Flo Gilman, the National Alliance for the Mentally Ill, had been trying to make some inroads into the court system here in DeKalb County. Ms. Gilman contacted me, and from that, what we did was scheduled a meeting to develop a task force. And at the task force meeting, that was when I first realized the amount of interest that everyone in the community had with regard to the issue of people suffering with mental illness and coming into contact with the criminal justice system.
Good morning, Ms. Thompson. I just wanted to acknowledge that you were here to observe this morning. Did you have any questions about anything that you've seen or any information that you've heard so far?
My concern is how long I would have to go to Diversion Court.
Do you have the paperwork with you that brought you here?
Yes, ma'am.
Nancy? Thank you.
We look at certain criteria to make sure that a case is appropriate. We look at the criminal history. We make sure that the criminal history is not one that's extremely violent. We look at the actual charge and make sure that the person didn't cause a victim any significant harm, and also that that case did not involve any weapons.
For so many of our cases, what happens is the police are contacted because a family member is ill and the family knows they need to get a hospital, they need to see a doctor. And so the only way they know how to kind of make that happen quickly is call 911. And unfortunately, because there isn't, good, accessible, affordable treatment in the community often, their only alternative to try and keep everyone safe is to put someone in jail.
Because it is a specialty court, because it is a diversion court, it's also a court of second chances. We want you to want to help yourself. We want you to look forward to participating in the program because we get greater outcomes.
I'd be in jail right now. If I wasn't in diversion treatment court, I'd most likely, after I saw that DA and after I saw the judge, I'd be in jail. Versus coming here, they keep you on track with your appointments. If you're not on track, they're going to let you know that you're not on track. I did what I did. I wasn't in control of myself when it happened, but it happened. I have to face the consequences for my actions. And this, instead of sending me to jail, it gives me a chance to work on it. Myself, never having been in military service, there's particular issues that a veteran may have to deal with that I have no understanding of. So working with Mr. Harrison is a big help because there's some stuff that goes on with veterans that I would never understand.
This would not work without them, okay? And I'm finding even on a wider range, on a wider scale, as I'm coming into contact with other courts, it's kind of like this model that, I tried to sort of present to them because, this is the one that works. It's the greatest one in the area that I cover. I cover all the area above Macon, Georgia, all the way to the end of the state. And this is the best, period.
Everybody wins. That participant wins, the family of that participant wins, and our community at large wins because we have somebody who knows what their challenge is. They've taken steps to correct it as best they can so that we don't have somebody going to jail again for repeatedly for the same thing. That saves money because the jail costs money. It saves a family, okay, because at some point it just gets old and they get tired and the person is then on the street, they're homeless. in a lot of instances. So it's a win-win when everybody buys in and we try and get these people and get them the help that they need so that they can return productive and well.
It's transformative. This court changes lives. It absolutely changes lives.
All right, that's just a little information about the Misdemeanor Mental Health Court. We're in session the first and fourth Thursdays in the main courthouse, and you're welcome to come by anytime for an observation. We're back live when things are safe again, but we're on the first floor of the main courthouse, and you're welcome. That's it.
Thank you very much, Judge Stroud. For someone we've had on the chat line, people wanted to know what those offenses were again. Is there that information available somewhere else, or could they contact your office to get a list of the offenses?
That list, we have a web page, and that information is there live for them at the DeKalb County Magistrate Court website, and then click for the Misdemeanor Mental Health Court website specifically, and they are listed there.
Thank you so much, Judge Stroud. That's the first time I've learned about the Court of Second Chances. Very informative, very informative. Thank you. Our next speaker is with the DeKalb County Community Service Board. That speaker is Renee Dreifus, LCSW, I guess that means social worker, and she also has an MBA and Chief Clinical Officer for the DeKalb County Community Service Board. Ms. Dreifus.
Thank you. The DeKalb Community Service Board is a public nonprofit provider of community-based mental health, substance use, and developmental disability services. We have over 20 locations throughout DeKalb County, serving individuals from ages 4 through adulthood. And we have served the citizens of DeKalb County since 1994 through our diverse workforce of over 480 clinical and support staff who are dedicated to serving our community. As an instrumentality of the state and contracted by the Department of Behavioral Health and Developmental Disabilities, DeKalb CSB is the public safety net provider for DeKalb County and serves individuals who are uninsured or who have Medicaid. We serve those who have really no or limited options for services. As a behavioral health and developmental disabilities provider, we deliver quality person-centered services with a focus on recovery and helping clients achieve their fullest participation in our community. And as you see on here, individuals can join and start their recovery with us by contacting our central access line, 404-892-4646, which is our single point of entry, which allows us a rapid access to services. Actually, if you want to go back to that other slide, thank you. We'll sit on that one for a minute. Our services start with an intake appointment in which an assessment is completed and a treatment plan is developed based on the client's needs. And we offer many outpatient services, as you see on the slide, including psychiatric evaluation and treatment, various types of counseling, individual, group, family. We offer some specialty programs. We have a peer support program that is run by peers who are individuals who share their own lived experience in helping others achieve their own recovery. We have community-based services, including case management and what's called psychosocial rehabilitation individual, helping people develop the skills to stay in the community. We have a psychosocial rehabilitation program, which provides services for people that have more severe and persistent mental illnesses, giving them the skills to develop their full potential. We also have a supported employment program, which is an evidence-based practice that helps people with mental health challenges work at regular jobs of their choosing. And I wanted to note that during this time of COVID, one thing that's been really exciting is that our supported employment team have been hard at work helping individuals gain employment and have assisted over 50 individuals in obtaining employment during this COVID pandemic, which I think is quite phenomenal. We also provide independent residential services for homeless or low-income individuals who have a serious and persistent mental illness. The residents of this program have frequent contact with a case manager who helps them live successfully in an apartment with a roommate. We provide child and adolescent services that include clinic-based, community-based, and school-based programming for youth who have mental illness, emotional disturbances, or substance use issues. We work closely with DeKalb County schools as well as Decatur City schools to provide a school-based program to address the ongoing mental health needs of students. And we continue this service throughout the pandemic and helping to really help our students in our county deal with the stressors of not being in class and being virtual and not amongst their friends. Our school-based program is called APEX, and we have had a therapeutic summer camp each summer, which has been a really important feature of our year-round work with youth and helping them deal with their mental illness and mental health challenges. This year, we were excited to be able to expand our services with a collaboration with DeKalb Parks and Recreation, and we provided group sessions for children and parent support groups as part of the CARES COVID funding we received from DeKalb County. The CARES COVID funding has also allowed us to move outside our own clinics and walls. And as you see on the slide, we now have a mobile telehealth van, and we are providing services in the community, going to various sites that we can offer services to folks that, may not feel comfortable coming into a clinic, or really it's in their best interest to stay outside of a clinic wall. Our substance abuse programming includes services through outpatient to residential and jail-based setting. We have outpatient counseling at all of our outpatient mental health clinics. We also provide day treatment through our DeKalb Addiction Clinic. And we also opened our opioid residential treatment program to serve the growing opioid pandemic, addiction pandemic in our community. Opioid addiction has been growing, and the pandemic really has fueled that flame as well. And we're very thankful to the startup funding we received from DeKalb County to help us provide this program, which has really shown some quite good positive outcomes for the individuals we have served there. In addition to our robust behavioral health services, we also offer developmental disability services that include residential and day treatment services, as well as supported employment. You can go ahead to the next slide. And I'll talk about our crisis services as well. We operate the Regional Behavioral Health Crisis Center that serves DeKalb, Fulton, and Clayton counties. And this service is for adults who are dealing with a behavioral health crisis, who are in need or need of withdrawal management, or what most people call detox from alcohol and drugs. The Crisis Center is designed to serve as a first-line community-based alternative to hospitalization. We have 3 distinct services. One is our Crisis Service Center, which is really an outpatient evaluation unit that we are able to screen and evaluate 24/7, 365 days of the year. We offer a 23-hour temporary observation unit, and we have a 36-bed crisis stabilization unit. And our goal there is to provide stabilization for our individuals that we're serving and help them connect to ongoing care in the community once they have completed their inpatient stay. The Crisis Center is a really important resource for our uninsured clients and individuals in DeKalb County. The actual CSU part, the 36-bed part of the Crisis Center, is only for those that are uninsured, and that's a really important need for our community. I know that Cheryl Reese is going to be talking about our mobile crisis service, so I'll save that part of the slide for her.
Thank you very much, Ms. Dreifus. And you already have introduced her, so let's learn more about Nurse Cheryl Reese. She has her master's in nursing. She, again, is with the DeKalb County Mobile Crisis Center.
Hello, everyone. Can you hear me?
Yes.
Okay, great. I am so excited to be on this forum. I have been a mobile crisis nurse for about almost 20 years, and I am truly enjoying it. It is where I belong. So this unit is a specialized unit, and it consists of a crisis intervention trained officer through DeKalb County, and we've expanded. We've hired more nurses and a seasoned psychiatric mental health nurse that is provided through the DCalb CSB. And our referrals can come from anywhere. It doesn't matter. You can be a passerby on the street. Our merchants, other resource providers, personal care homes, family members, friends, clinics, treatment providers, anyone can call us. And we have grown, and now people are becoming more familiar with our services. We operate only in DeKalb County. If we get a call from an outside county, then we'll make sure that person is put in contact with appropriate personnel. Okay. So we operate with the intention of diverting our clients from jail. We know that they're sick and we know that they need help. So we're going to get them where they need to be. It may take a couple of attempts, but eventually we're going to get them there. And when they see that unit driving out in the community, a lot of our clients are familiar with us, and they'll flag us down, or they'll call the crisis center for us to come and pick them up. And all of our calls are related to mental health and substance abuse issues. The mobile crisis unit operates 7 days a week. We have scheduled hours, and hopefully we're going to be increasing that time very soon. And I consider us to be trailblazers. We are truly trailblazers. You can only find this service in Nashville and Amsterdam, and DeKalb County, #1. Next slide. And if we get a call and we're not able to help that family or that client, which is not very often, then we make sure that we provide other community resources for them. We just don't leave them by themselves to deal with their loved one, friend, or family member. We have great relationships with other local facilities, other hospitals, Grady, DeKalb, all of our local facilities, and we usually utilize their emergency facilities. And they've come to understand the services that we offer out in the community, and we're received with open arms. And also other police precincts, they call on our services because they're not familiar with a lot of services out there for our mental health clients. And if they're within DeKalb County, we will assist them on those calls. And we usually work closely with the local fire departments, emergency response units, and we all play a very special part in helping our clients. And I would like to mention our follow-up service. We don't ever leave our clients and their families to deal with their issues. We always go back. We always follow up. We never forget about them. So that is a great service also that the mobile crisis unit provides. And we have strict guidelines, very strict guidelines that we follow. And those guidelines have helped to make us a good and well-performing service. We always treat our clients with the highest level of dignity and respect. We never use the word crazy. We let them know that we believe that you are experiencing what you're telling us, and we believe that. And that's why we are not going to judge you. We always say we're not judging you. We're here to get you to where you need to be or where you want to be. And this service has grown tremendously. We're now over 35 physical visits. That means having face-to-face encounters with our clients. And we could do more, but we needed more personnel, and we do have more. So we're going to see those numbers go up higher. And I am a true advocate. It took me a while to realize where my place in nursing needs to be. And I am truly an advocate for our clients. And I consider it an honor to be amongst people that are standing together and advocating for our mental health community. And I thank you all for this opportunity.
Thank you, Nurse Reese, for sharing that information. That's so important. I need to mention to you who are putting in the chat questions, I've been asked to tell you that because we have so many speakers, we will not be able to take questions that can be answered online. So if you could go to the provider's website and ask your question. Or I would say to my providers, since you're on the chat, if you see the question sent to everyone, if you would mind responding to that person directly, it would help a great deal. Our next speaker is from NAMI DeKalb. Now, some of you may wonder, what is NAMI? NAMI stands for the National Alliance on Mental Illness. It is one of the largest, matter of fact, it's the largest grassroots group that works with the mentally ill, not only the person experiencing the problem, but with their families too. So here's our speaker. And our speaker is Mr. David Kendrick, who is Vice President of NAMI DeKalb. Mr. Kendrick.
Yes, thank you for that introduction, Monica. My name is David Kendrick. My name is David Kendrick, Vice President of DeKalb, and we are the National Alliance on Mental Illness. And we are here in DeKalb County to help individuals and their families take care of individuals who have been diagnosed with a mental health diagnosis. And what we do is provide support through a couple of different programs. And the programs that we offer is called NAMI Peer-to-Peer. And peer-to-peer is a program for people who are diagnosed with a mental health diagnosis. And it's right now, because of COVID, everything is online. So we together with a trained facilitator who presides over a group of individuals with mental health diagnosis. We talk and explore some of the things that are going on with their mental illness, so that they can see answers from the individuals who are like them. Because with a lot of mental illness, you can't really see it from the outside. So you may pass someone who's dealing with a mental illness and not exactly know what's going on. So we have these support programs here that is a safe space for individuals and their families to talk about their mental illness. Our next program that we offer is called Family to Family. Family to Family is a free 12-week program for family members or caregivers of individuals who are diagnosed with a mental health illness. And this program is important because we have our, as our parents age, or we have someone who's born with the mental health diagnosis, we may not know how to care for them. And like some of the programs before us, we want to try to do our best to keep them out of jail so they don't go into some of the mental health programs that are offered in jail. So Family is a program for other individuals who are taking advantage or who have someone who is diagnosed with mental health diagnosis, just to get answers from other family members and seek guidance in a safe space where people are just like them, taking care of individuals with mental health diagnosis. And also have NAMI Home Front, which is a free 6-week program for veterans. So if you have someone in your family or you take care of veterans, NAMI Home Front is a free 6-week program for you once again to get together with individuals or veterans suffering from mental health illness in a safe space with a trained facilitator.
Mr. Kendrick, we're having a hard time hearing you. You're breaking up. You've been breaking up. We're having a hard time hearing you. You're breaking up. We're having a hard time hearing you.
All right. Is this a little better?
Yes. Yes. Yes.
Okay. Sorry about that, guys. So our programs that we offer all of our programs are free and they differ in length. So we have peer, which is for individuals living with a mental health diagnosis to get together and come along in a safe space with a trained facilitator. And then we have NAMI Basics, which is a program for parents or guardians of individuals 22 or younger who are struggling with a mental health illness. And then we have NAMI Homefront, a program for individuals who take care of veterans with mental health diagnosis. And then we also have In Our Own Voice, which is a program where you can request a speaker from NAMI DeKalb to come to your organization and give a free 40, 60, or 90-minute presentation. And this slide right here is all the ways that you can get in contact with us. Monica?
Yes.
Okay. I'm getting messages saying that I'm still going in and out. Can you guys hear me?
Yes, you are.
Okay, so were you getting anything that I said?
Some of it did come through, but not all of it.
Okay, well, I can kind of wrap things up in a nutshell. What we do is offer programs for family members who are taking care of individuals who are living with mental diagnosis. And you can all take advantage of our free programs that we hold online via Zoom, and they're all conducted by a trained facilitator. And this is the information on how you can get in contact with us. You can visit NAMI.com.
Thank you very much, Mr. Kendrick. We're going to have to get you an Ethernet line the next time because you provided some really good information. Thank you again. And I will tell everyone who's on this Zoom call, at the end, we will provide all of you with the names and the web addresses for all the people who actually presented today. So if you have more questions, you'll be able to direct them to them. The next agency that will be presenting is Chris 180. I know a lot about this agency because I had a nephew who we took there for services who was dealing with his sexuality, and they provide services for children who are LGBTQ. But then they also provide counseling as well as housing, anything that a child needs behaviorally. And the speaker today will be Brittany Walters, licensed social worker, vice president of Basis Mental Health. Brittany.
Good afternoon, everybody, and thanks, Monica, for that wonderful introduction. I am really thrilled to be here with you all and walking alongside so many other awesome providers in our community, because as we know, it really does take a village. Chris 180 is a private nonprofit that's been serving Metro Atlanta since the early 80s. If you've been around Atlanta for a while, you may have heard of us before we changed our name. We used to be known as Chris Kids. And we rebranded in 2016 because we've grown leaps and bounds, and we now specialize in many things under the realm of behavioral and mental health, past just treating children, which is kind of where we got our reputation from. So as Monica mentioned, we provide an array of services and a continuum of care for children, adults, and families of all ages. And so I'm really excited to tell you about just some of what we do today. A lot of people, the first thing that people ask me is, who's Chris? And we always kind of joke that, you know, we really need to explain our name when we introduce ourselves to the community. So Chris is actually an acronym that stands for our values, which are creativity, honor, respect, integrity, and safety. And the 180 is a symbol of how we help people change and make a 180. So sometimes we explain to people that we provide 360-degree services to help people make a 180 in a lot of cases. We are able to, and we do work with people that have all types of insurance, so all of the Medicaid and care managed organizations, as well as private insurance. We also get really creative in order to serve those that are uninsured or underinsured. I think somebody in the chat mentioned previously, well, a lot of people have insurance, but they can't afford their copay, or they don't have access to reasonably priced services. We really have diversified our funding streams to be able to serve everybody. And our motto is that we're never going to turn anybody away. Now, we might have to get creative about what program and what funding and how we can cover those services, but then we're also really committed to helping people navigate applying for insurance, getting their Medicaid reinstated, or if they're not eligible for Medicaid services, we can help them apply to access state dollars if they qualify for certain programs. So I really love that we do that because, again, it's all about reducing barriers and increasing access. So at the epicenter of what we do is kind of dynamic outpatient core services to individuals along the lifespan. A few years ago, we had 2 outpatient clinics, and now we have 10 throughout DeKalb, Fulton, and even as far up as Gwinnett County. So we provide individual therapy, family therapy, group therapy, skill building, and then board certified psychiatry for those that require medication. And what sets us apart from other providers in a way is that we have a real vested interest in fostering the creation of dynamic clinical professionals. What we know now about trauma treatment is that talk therapy doesn't work for everybody. And when treating trauma in children and youth, and unfortunately we are seeing those PTSD diagnoses come early and earlier, we know that it's important to get creative. So we do send our professionals to things like art therapy training, EMDR training therapy, play therapy, you name it. We have a vested interest in really training our staff in those cutting edge evidence-based approaches. Outside of our clinic and center-based services, we have a large school-based program. And I am actually new to the role of vice president of our school-based mental health program. For the past 3 years, I've been the clinical director of our outpatient centers. But our school-based program has also grown leaps and bounds in that we're partnered with 68 schools throughout DeKalb, Fulton, Clayton, and Atlanta Public Schools. And so those partnerships vary in terms of what services we provide. At the core of all of those partnerships are the services I described previously, but in some of the other schools, we provide trauma training, teacher consultation, redesigning of classrooms to make the setting and the environment more trauma-informed, because we do know that setting teachers up with an environment that's conducive to learning is half the battle, as opposed to targeting one child that may be displaying behavioral issues that are disruptive to the class. So it's an honor and a privilege to really work primarily with that department now. We also have a community-based early childhood intervention program funded by SAMHSA. We have 2 substance abuse intensive outpatient programs for both teenagers, young adults, and older adults. We have a statewide high fidelity wraparound program for higher acuity youth. We know that there is a lot of recidivism and return to hospital settings for those that go into crisis frequently. And so we have kind of a higher level of care for those that might require a little bit more outside of that 1 hour of therapy per week. We have an integrated health clinic, which provides mental health services as well as primary care. That's actually a partnership with Mercy Care, who I think is represented today on the call. We have reentry programs partnered with our jails, helping adults return to the community after incarceration and gain access to things like housing, employment, and all of the other services I've described. We are partnered with both DeKalb and Fulton Juvenile Courts, providing court-based services for some of their accountability programs, as well as some other innovative programs that they've got going on in those settings. We have 7 group homes, and we provide 24-hour care for 42 children that are in the custody of DFACS. We have a permanent supportive housing program for young adults that are aging out of DFACS care, or they're young adults between the ages of 17 and 24 that are at risk of or already experiencing homelessness. We have an outreach and community housing program that has several different funding streams to provide rapid rehousing, bridge housing, and even emergency housing funding to prevent evictions. We have an adoptions and foster care program, and as Monica said, we have gained quite a reputation for our advocacy of LGBTQ youth in Metro Atlanta. We work with same-sex couples to help them navigate that process of adoption. We have drop-in centers for young adults experiencing homelessness or needing access to housing and other resources. We also provide the supported employment and supported education service that was described earlier. We have a robust training institute where people, providers, organizations, private foundations, they can hire us to provide any type of trauma-informed care training, or they can rent space in our training institute. We have several programs over on the west side, really partnered with Atlanta Police, the Atlanta Police Department in healing the community and really targeting the crime that we're seeing youth engage in as a result of gang recruitment in certain zones. And so we're really proud of what we've built with the At Promise Center, and we actually are building 2 more At Promise Centers at the moment. And then I like to say a partridge in a pear tree. There are several programs that I haven't even been able to get to today, but those are the highlights. Throughout COVID, we have definitely pivoted our 400 plus employees to providing all of our services via telehealth, or found a way to safely provide them in person. In addition, we're really proud of the food distribution that we've kind of created out of thin air. We are serving food to nearly 3,000 families per week. And many of them are on a delivery schedule where we actually are delivering bagged groceries and sometimes prepared food from Mercedes-Benz Stadium to these households to make sure that they have enough to eat. And then we also have pickup locations that people can drive through and get access to pretty quality groceries. So all that to say, our mission statement is to heal children, strengthen families, and build communities. We pride ourselves on our creativity, out-of-the-box thinking, and commitment to reducing barriers and increasing access to quality services for all who need them. So I appreciate you listening. Visit chris180.org for more information. There's a lot of phone numbers, emails, referrals. We are here for the community. If we can't help you, we will find somebody that can, but we have such an array that typically we can find a way to help. Thanks for listening.
Thank you very much, Ms. Walters. And again, her information for Chris 180 will be provided at the end of this session so that you can contact them. I'm checking the chat line and I see a lot of questions that are going to the sheriff. If you will scroll back up to the chat line, some of your questions have already been answered and the information can be found on the chat line. So next, we're going to go to Mercy Care. And Brenda Sebelius, APRN, BC, CGP. I want you to explain to me what all those letters mean, but she's the Director of Behavioral Health Services for Mercy Cares. Brenda.
Sure. Hey, good afternoon, everybody. It's really actually exciting to be here. I used to work with DeKalb County in a variety of ways and recognize a lot of people on the phone, a lot of the services. And DeKalb County has amazing services, really puts so much attention to it that to be able to be here as part of Mercy Care is really exciting. So great services. So I want to tell you a little bit about what Mercy Care is. Mercy Care is a federally qualified healthcare center. And it's actually widely regarded for all of the services that they bring to the community. You're going to see on this slide set some of our locations and some of our services at the locations, but just for a minute before we go through them, Mercy Care is an organization that has integrated care. So we have primary care, we have integrated behavioral health care, we have dentistry, we have vision, we have infectious disease like HIV, and we have some really creative programs out of each of those streams. So regarding mental health, what behavioral health is integrated behavioral health, is that we work very closely with all of the other providers that we have because we view health as whole health. If you are not healthy through your behavioral health, through your use of substances, through your chronic hypertension, through your diabetes, and you're not managing these chronic illnesses because you have some essentially barriers. You have some either mental barriers to or behavioral barriers to why you are not managing your physical illnesses. You need some help with that in an integrated way. I mean, all of us have had different illnesses, and maybe we just don't follow the diet. We really don't take the medication. We don't do any of the things or some of the things that are required, and there can be some behavioral work done with that, and we have some tremendous outcomes from that. We also have traditional psychiatric treatment in regards to medications, behavioral health treatments in regards to therapies. Also with substance use disorders, we have some programming around that, and we're going to be moving into more of some medication-assisted treatment. Through behavioral health, we also have street medicine, which is a group. It's primary care, behavioral health care, nursing, case management, who actually go out onto the streets. We all know we have a homeless problem in DeKalb and Fulton County, and really in the state. But people who will not engage in treatment, there are additional efforts that are needed to be able to talk with them. And just like mobile crisis, just like Cheryl talked about how you must create, some relationships, and they must see you out there, and you must be very directed with how you're going to be helpful. For this population, we have essentially a medical care, psychiatric care office on wheels, because a lot of people, either because they know that they have certain issues, they know that they are not clean, they know that they are not patient to wait in line, and so some people just will not come into a clinic, and we have to be able to work with them. And we also have recuperative care units for men and women who are homeless, who are being discharged from area hospitals. And if they go back out onto the streets, you just absolutely know that they are not going to be able to take care of themselves, potentially even survive. 50% of these people will be back in the emergency room or the hospital within 2 weeks. And about 80% of them would be back hospitalized because, they have friable diabetes, and they have wounds, and they have this and that you can't care for that on the street, in regards to the lack of cleanliness, diet, all of that. So the 2 units that we have, one for the men is housed at Gateway, one for the women is housed at the City of Refuge, is really a case management unit. It's not really a nursing unit, it's a case management unit where we help people stabilize in a recuperative care kind of situation. We also have, within our behavioral health realm, we also have, we have doctors, nurse practitioners, therapists, we have substance use professionals and peers, both mental health and CARES peers, people who have the lived experience. So in a lot of our programs, like let's take for instance the HIV program that we have infectious disease folks who are working there. We have mental health folks who are working there. We have housing. We have a whole variety of our team because of all the various needs, with that particular illness. We also do a lot of work with our partners. And what I mean by that is Mercy Care has quite a few clinics. Some of them are our own, like the Big Chambly Clinic up in DeKalb, where we treat adults and we treat pediatrics with all of the services, primary care, dentistry, behavioral health, vision, all of the ones I've talked about. But then we are also embedded in different places. We're embedded in the City of Refuge. We have a big clinic there. We're embedded in Gateway. And these are clinics that don't just treat City of Refuge or Gateway. We open our gates to that entire community. And we already know where the City of Refuge is located, behind Mercedes-Benz, off of Boone. Some of these are the roughest zip codes in Georgia in regards to being a food desert, a care desert, you know, all kinds of needs there. And then the downtown Gateway Clinic, you know, very much open to the streets. So overall, Mercy Care takes all insurances. We also take people without insurances because we have a very generous sliding scale. We also are healthcare for the homeless. We're the only FQHC with that designation here in Georgia. We've recently expanded out to the Musk Ministries to create a clinic out there for DeKalb County. And we really value our partners. We've done a lot of work as well with Chamblee Police Department and a lot of the other folks. It really seems like, and I think that's the theme of a lot of what we're talking about today, how we lock arms, because, you know, with behavioral health and with substance use disorders, a lot of times what we're seeing, what everybody's seeing, are the behavioral implications, and the behavioral implications that then mean that all of us in all of these arenas must partner together to successfully help our people, our families, and our community. So the slides are just a couple of our clinics so that you can see exactly where they are. Past Chamblee, this is Decatur Street. We also have big mobile vans. We will go to different locations. We do go to Chris 180 to provide integrated care and primary care. And for most of you who are providers out there, you know that we have an issue. Everybody has an issue with dentistry and oral health. And many of the cases that are seen at Grady's ER, they walk in, you know, with tooth pain, all of that. And so, you know, we have dental clinics as well. So overall, we are all about whole health, and we feel like we really need to treat the whole person. And whether that is illness, housing, case management, mental health, everything needs to be integrated. So that's who we are.
Thank you very much, Brenda. And the group is called Mercy Care. You provide a lot of mercy to a lot of people. Thank you so much for what you do. There's a question on the chat line that I'd like for some of our providers to look at, because in one case it's asked, are these providers offering any racial specific therapeutic services? So if you can find that question on the chat line and respond to them, it would be wonderful. Our next presenters are moms, mothers affected by mental health. Please welcome Ms. Lori Freeman and Ms. Bray Billups. Ladies.
Good afternoon. I'm going to try to say good evening. Can everybody hear me?
Now we can.
Okay, perfect. My name is Bray Billups, and first and foremost, I want to say thank you to CEO Thurmond, to Captain Hughes and DeKalb County Police Department, as well as you, Ms. Pearson, and all of the personnel that have joined in today to help make this virtual fair a success. As CEO Thurmond stated in his opening, this whole initiative just kind of came out of a desperate mother who had lost a child who was going through a mental health crisis. And at the time, I just wanted an opportunity to sit at the table with him and discuss different programs or ways we could form alliances to stop this from happening to other families or families who did not know where to go to get assistance. You know, what is available in DeKalb County, considered one of the largest counties, you know, in the state of Georgia. And instead of him giving me 10 minutes, I think we sat and talked for over 2 hours. And I am grateful for that opportunity. I am even more grateful today to sit and listen in on all of the initiatives that have been launched since 2017, following the death of my son. I consider myself an advocate for him, even though he's not here, as well as the mental health community and the families who are impacted daily by mental health. As we move forward into 2021, I hope to see great things come from DeKalb. I know we can top this. I looked at the participant list and it got as high as 167. And so that definitely brings a smile to my heart because it lets me know that we do have people who care. And it's all about breaking the stigma, letting people know it's okay. And that if we all join hands and look for ways to build one another up instead of tear one another down, you know, we can definitely move forward and make this thing bigger. Hopefully it'll become a domino effect and it will filter over into surrounding counties and they will look at what CEO Thurmond is doing and say, you know, I want to be like him or be better. And then that way we know everybody who is suffering with some form of mental illness, we know they'll be helped and not cheated and know what's available to them in their county. So once again, I just want to say thank you to everyone who's joined in today.
And we want to say thank you for being the genesis of this. Lori Freeman, would you like to make some remarks?
Thank you to DeKalb County Police, Monica, Chief Ramos, CEO Thurmond for this wonderful opportunity to engage in mental health awareness today and each and every day. A big congratulations to the viewers today because you being here today expands your knowledge about mental health resources, not only for your family, but it will extend to your loved ones, your neighbors, your coworkers, and inevitably your community. Our gathering here today is just such a fun example of how making connections creates community and confidence and hope, which inevitably leads to our shared experiences providing recovery opportunities for people in need. So why am I participating today? Well, sometimes navigating the waters of mental illness and mental health recovery can seem like dark and turbulent waters and waters that we're not accustomed to navigating. My own experience is that I have a loved one who experienced a mental health break while in college. He was arrested by DeKalb police who were coming to my defense. At the time, there was no crisis intervention team training like there is today. They were trying to help me. I was trying to help my son. It took a good 2 months to navigate those waters to make the connections needed. And you know, sometimes when we're on those rough seas, it seems that we are doing everything as a parent to just try and balance the boat. Sometimes people jump off. Sometimes they cling on. Sometimes you throw a life preserver to somebody and it works for a little bit, but not for long. But the purpose of today is for us to all come together and provide resources so that you know where to hitch your boat. You know where, when the time comes, that you know for an emergency, for example, where on the beach you can find that resource. Because you know what? There's not always those flags that you see on the beach. Some of us have little signs and symptoms that we may, in retrospect, say, oh yeah, he or she was doing this or that. But that's not always the case. Sometimes the wave just hits your boat like a tsunami and you don't know what to do. So this is the purpose of our being here today. The purpose of my being here today is to let people know that it is important as an advocate to educate yourself and to create alliances, sometimes with the people that you may think are your enemy. It would have been very easy to hate on those police. I consider them my dear friends today. And as a result of educating myself and listening to their perspective and theirs to mine, we now are doing great things together. Working with the Misdemeanor Mental Health Court is such an honor. My loved one went through that court. He's doing great today. Each of our stories is unique, certainly, but we all have a common shared experience. And, you know, I just hope that the goal is for each of us to just make a connection. By making the connection, we can reach our goals And when your boat starts taking on water, instead of feeling like you're just trying to find the pails to get the water out of the boat, you can depend on others. I'd like to thank my parents for joining us today. And I'd like to take this opportunity to tell my dad that he was the one who told me, and I want to share this with other parents. He's the one who told me that, you know what, doing everything yourself is not that commendable. You think sometimes doing things by yourself, sometimes you think you are the only one who can do it right, right? Moms are real guilty about this, and dads too. But he said that you are doing a disservice to yourself. You are doing a disservice to the people who can help you, because the root of the issue is, the goal is to get help, to make things better. And so hashtag self-care, and let's reach out to people in our community who can be your supporters. And then as a parent, I'd like to say, you can concentrate on being a parent. And while, yes, we are also a teacher, we're, sometimes we feel like we're law enforcement, we're all those things, but let's get the help of people who are willing and able to help us so that we can concentrate on being a parent. And I just want to thank everybody again, and to give hope to the parents out there and loved ones and family members that life is not perfect. It's not, but we can navigate the waters together. We can channel our energy. We have this, and feel free to contact any of us, and even me if you so choose. And thank you again for this opportunity. It's so wonderful to be here.
Thank you, Ms. Freeman and Ms. Billups, for your testimony. As pastors like to say, you took a test and turned it into a testimony to help so many others. Well, we have one more presentation, but before I announce that person, I just want to remind you that all of the providers today, we will give you their information so you can get in touch. There's an African proverb that says, "He who learns teaches." I hope what you've learned today, you will teach and share with someone else, and they in turn will do that. The information provided here today was just enormous and so helpful and so heartfelt, but don't keep it to yourself. Share it, not only with your neighbors, your family, your friends, but with law enforcement, also with others in your church. Again, he who learns teaches. We've learned a lot today, so now it's time for us to take the information we learned and share it with others. To wrap up this unbelievably good session, Captain Romaldo Hughes from the DeKalb County Police Department with closing remarks. Romaldo.
Wow. First of all, I'd like to say I'm overwhelmed by the response that we've had today. It's been some amazing information that has gone forth, and I just can't thank all of you enough. So at this time, as we close out, and we're actually getting out on time, which is amazing. So I'd like to first acknowledge and thank the CEO, Michael Thurmond, Director of Public Safety, Jack Lumpkin, our Police Chief, Myrtha Ramos, the police command staff, and all those here at the police department. I just want to say thank you all and acknowledge you for your commitment to this great cause. And I'd like to also say thank you to our awesome moderator, Ms. Monica Pearson, for always being so supportive of all of our efforts here at DeKalb County. Monica, we appreciate you. We love you. Tell John I said hello. And till the next event, thank you. To all of our partners, our county employees, all the public officials who work tirelessly to serve our great county. Thank you all for your enthusiasm and dedication as we continue to provide valuable resources to the citizens of DeKalb County. To the citizens and all the other participants that have been on today, to all DeKalb citizens and participants, thank you for your time, and thank you for trusting us as we continue to serve our great community. Last but certainly not least, I would like to give a great big thank you to Detective Weber for helping put this event together. She was responsible for the beautiful flyer that went out and all the graphics, and she was also our great Zoom host. And to our PIO, Michaela Vincent, thank you for your help as well. And as we wrap this up, I'd just like to encourage and acknowledge everyone to say, hey, let's continue to move DeKalb County forward together. Until the next event, Thank you all. We're going to try to flash up all the providers' information so that you all can capture that information. But if by chance that information, we can't put it together for you, DCTV has recorded this event. And I'm sure if you go to the website and look up DCTV, you'll be able to see all the information and replay all the slides and everything again. Again, thank you all for participating. It's been an awesome event. And until the next time, have an awesome evening.